Hello and welcome. First, Italy's poorest region, Calabria, has a new health chief after two quit last month over the handling of the coronavirus epidemic. In November, the then commissioner was forced to resign because he didn't have an emergency COVID plan. His replacement only lasted 2 days after saying people could only catch coronavirus if they kissed for 15 minutes. The situation is so bad that people who usually work in developing nations or war-torn areas have been drafted in to help. Well, Gino Strada is a surgeon and the founder of the Italian medical charity Emergency, which provides free healthcare to some of the world's poorest people, and is now helping in Calabria, quit after 2 days after saying people could only catch No, let's go straight to Dr. Strada now, who joins us. Dr. Strada, thank you so much for joining us here on the programme. It sounds like absolute chaos there.
Well, the situation is rather critical, not for a huge number of patients who contracted coronavirus, but because the health system here in Calabria has been disrupted and dismantled over the years. So in favor of the private health system, in fact, and this is what makes the situation so difficult for citizens down here. Calabria is a region inhabited by about 2 million people, and medical services are very, very poor.
You've had a phone conversation with the new health chief. Just tell me what message you gave to him.
Well, the message is that Emergency, the charity I'm representing, is available to help in this situation. And for the moment, we are based in Crotone, where we are soon opening a new department in the public hospital to accommodate patients with coronavirus. But we're also available to act on the territory of Calabria on a broader spectrum, because the problem is not just the hospitals, is the fact that the region of Calabria has not seen medical services for many, many years, and so the citizens have difficulties to reach hospitals and to find a doctor, to be visited and to be followed. And this is what makes the situation so complicated down here.
Things had eased, though, for a little while, and it seemed hopeful. And now this second spike is obviously having greater ramifications for Calabria.
Yeah, the second spike has been rather heavy, but again, fortunately, Calabria is a land where there are a lot of very small villages, quite distant from each other, so there are no huge cities where the epidemics could spread very, very quickly, and this makes the situation more easy to control. We are still in this second wave, and we hope that there will be not a third wave, because that will be really a disaster.
Dr. Strada, thank you so much for the work you do and for joining us here.